it's just a huge honor for me today to be podcast interviewing Kim Bryant, PT for physical therapist and DPT for Doctorate of Physical Therapist. Thanks so much for coming on the show.
Yeah.
So Dr. Bryant has her doctorate in physical therapy and has been practicing for 8 years right here in Ahwatukee and Lakewood with extensive work in functional rehabilitation. Dr. Bryant has taken additional coursework in the area of pelvic floor dysfunction. Her gentle, and by the way, my family puts the fun in dysfunction. And so Dr. Bryant has taken additional coursework in the area of pelvic floor dysfunction. Her gentle nature and fun-loving demeanor will have you living your life to the fullest in no time. Dr. Bryant was from Tempe, born and raised in Tempe?
Not born.
Where were you born?
In Austin, Texas.
Oh yeah, and then how old were you when you moved to Tempe?
8.
8. So you probably don't even remember Austin, do you?
Not really.
And now lives in the Ahwatukee area. She lives in Lakewood and works out of her home. Dr. Bryant has 2 young boys that keep her busy when she is not developing her business or out hiking or running. She has had her struggles with incontinence and postpartum depression after the birth of her first child and knows firsthand how challenging it is to overcome. My role in her journey, she says, is to provide current education and treatment in addition to one-on-one direct patient care to optimize your current and future life while helping you cope with obstacles that happen along the way. Kim Bryant. And you know what? It's funny because when I first read your website, it says that, you had struggles with these things that you treat, so you know firsthand. And when I was little, all the OBGYNs were men. And when they said quit being hysterical, that was really a slam because hysteros is Greek for mental. So when you're telling someone, when someone's complaining about pain and you're telling them quit being hysterical, it's a man telling you you're crazy. And the market reacted to that. And when they started, when I was in dental school, the senior class had 1 woman. My class had like 10 out of 120. And now all these dental schools are half and half. And it seems like women have taken over OBGYN. Basically, women want to be treated by women. I see that in pediatric dentistry too. You go to any of these dental schools and you look at the 4 or 6 students in postgrad to be a specialist in pediatric dentist. I haven't seen a man in that program in years and years. So you think being a woman and having had some of these issues helps you relate?
I absolutely think so because you have walked in those shoes. You can definitely relate and have all those same feelings and pressures of life. Men and women are just different, so I can relate with women in that way. So.
We're very different because as a man, I can't help but notice that the average man dies at 74 and women are 79 and a half. And I've been to several nursing homes in the area and it's all women. Usually it's all women and 1 man named Lucky.
Yeah.
And so you guys, and that's also, I was talking to an orthopedic surgeon one time and I said, and I was showing him the data where women break their hips so much more than men. I asked him, why do women break their hips so much more than men? And he says, well, it's hard to break your hip when you're lying still in a casket 6 feet underground. They just live 5 years longer. So they have 5 more years to slip and trip and fall down.
Yep, that's very true.
So what was going on in your life journey that made you go down this path to get a doctorate in physical therapy?
Well, I had always been involved with sports, especially soccer. Played club soccer, played in high school, played in college, and was always around injuries. And I wanted something that was active. I wanted something that was helpful for people. My mom is a school nurse, and so
In Tempe?
Yeah.
Is she still?
Yes.
Same school?
She was at McCamey Junior High, and then when they closed that, she moved to Broadmoor Elementary School. So yeah.
So elementary, that's 1st to 6th?
Kindergarten through 5th, I believe.
Kindergarten through 5th. And she's a school nurse there?
Yeah.
Wow. I bet she's had a rough month with the flu epidemic.
Yes.
It's really, they said it hasn't been this bad since 2009.
Yeah, she's been sending a lot of kids homesick.
And we're almost at 100 children deaths for the nation.
That's horrible.
Yeah, I mean that's crazy.
Yeah, that's really sad.
And it's so weird because there's, if you go back a century, I mean, this is 2018. So if we go back a century, by the time it was 1917, we would have already had the Spanish influenza which killed 5% of the planet. In fact, the city of Philadelphia bought its first steam engine because they couldn't dig the graves fast enough. So they had when someone died, you laid them on the curb, and the firemen come horse and carry and threw the body on the deal, and then they had bought their first steam engine. And then what is it, 100 years later? Now everybody's against vaccinations. And every year in the United States, between 8,000 and 38,000 die of the flu. And they say this year it's going to be close to that 38,000.
Yeah, that's scary. So yeah, I've always, I grew up with my mom being in the healthcare, and I grew up very active around lots of sports injuries and rehab, and I knew I didn't want to have a desk job. I wanted to make a difference. I wanted to make my mark, and I graduated from ASU with a degree in kinesiology, and
I know, that's where I went.
yeah.
I had 4 boys. 4 boys. The good one went to ASU, and the other 3 went to NAU to get a degree in snow skiing.
Oh, well, there you go.
Yeah, they're all excellent down. And so you went to ASU, got a degree in kinesiology?
Kinesiology.
Kinesiology. You're going to have to explain to my homies what kinesiology means.
Yeah, it's the study of body movement. So took courses in anatomy, biomechanics, took some really fun electives like tennis and aerobics, but that was all part of it. So motor planning.
And then after ASU, where did you go?
So I took a couple of prerequisites that I needed for grad school, and then I went to AT Still University out in Mesa.
Wow, I love that place. They have a dental school too.
Yes.
So that's where you got your doctorate in physical therapy, AT Still?
Yeah.
Did you ever meet the head of the dean of the dental school, Jack Dillenberg?
No.
Yeah, that's an amazing campus, amazing program.
And it's grown. They've got a YMCA there now. And they've got a couple other new programs there, too. Yeah. So, yeah, it's really growing.
So when you were in soccer, I find that very interesting, where I just watched a documentary that in America, they think football is the NFL. And they think concussions are with helmets bumping heads. But this program was saying they got all these World Cup famous soccer players who are in their 60s. They have the same problem.
Yeah.
And it's so bizarre how, and I don't think it's bad if you put it in perspective. I mean, 2,000 years ago in Rome, the first city hit 1 million, the amphitheaters were feeding Christians to lions. So I'm sure any of those guys getting fed to lions would have rather had a head concussion than having a lion eat your torso.
Yep.
But it's funny how in soccer you can't use your hands, but they're bouncing the ball on the front of the head. And then in boxing, it's even crazier. In professional boxing, they wrap up their hands to protect their hands and then beat each other in the head. If you ask anybody to go punch a brick wall as hard as they can, they just go like that. But if you put a 16-ounce glove on it, you'll smack it, you'll crack the concrete. It's funny that we're such a primitive time that we protect our hands over our brain.
I know.
So you said you're around, and we know what the chances that you could go to like the rest of the world in soccer and say, hey, we're going to quit using our head, but you can use your hands. I mean, could you imagine saying that in Brazil? I mean,
Yeah.
you wouldn't have.
They would just laugh.
Yeah, I mean, there's no chance it would change, but you can't get them to us. So what kind of injuries were you seeing in soccer? You said you're around a lot of injuries in rehab. I know the rehab's drinking. After the soccer games, I assume,
yeah, when
right?
you lose, right? ACL injuries, meniscus injuries, ankle, an ankle sprain, even shoulder, dislocated shoulders. I saw those were probably the major ones. I broke my wrist and hand.
You broke your wrist and your hand in soccer?
When I was when I was younger.
You're not supposed to be using your hands. You were cheating. You were cheating.
I know. And then I played in grad school and even after grad school, and I ended up unfortunately having a weekend warrior injuries, and I've torn both my ACLs.
And explain what an ACL is.
So it's the anterior cruciate ligament. It's one of the largest stabilizer ligament of the knee. Unfortunately, women are more likely to tear, and soccer's huge for that type of injury, especially in females. So
you've been in Ahwatukee for 8 years now, right? Or you've been practicing 8 years?
I've been in Ahwatukee 6 years. Been practicing for 8.
Well, we don't care about Tempe and those other other towns. But my homies probably want to know, in Ahwatukee, who is your client base? Is there any demographic? Is it more women, men, younger, older? Is it repetitive task at work? Is it weekend warrior? Explain your clientele.
Yeah, so with my specialty in pelvic floor dysfunction, I currently see only women. However, pelvic floor dysfunction can be men, can be children, and women
Okay,
as well.
I guarantee you no one's ever heard of pelvic floor dysfunction. So why don't you back up a little bit? Most people think dysfunction is your crazy aunt at Thanksgiving dinner.
Yeah.
But you're saying that your own pelvis has dysfunction.
Yes. So there's all other names for it. There's pelvic floor therapy. There's women's health, physical therapy. There's gynecological physical therapy, pelvic rehab. So those are all different names that are pretty much about the same thing. So is it okay if I grab my model?
Sure, absolutely.
Okay.
But explain why it's why you treat more women than men. So is this after delivery? Because I know the unique thing about women is the pelvic area is basically softens up and kind of comes apart to let the baby out and then goes back together. Is that the cause of most of your patients' pelvic floor dysfunction?
It can be some. So some of the reasons that can happen is just our posture also changes quite a bit to make room for the baby. So our breathing patterns change. Our spinal curvature can change. Our muscles of our hips and our chest and shoulders kind of make those adaptations and shortening because of that change in posture. And so if I don't teach these women how to restore that, then that just places them at higher risk of a back injury when they're trying to get the carrier in and out of the car, or later on down the road when they start to go back to some of those things that they enjoy doing, hiking, running.
So urinary incontinence is when you urinate when you didn't mean to.
Yep, absolutely.
Well, I just had a physical last week and he said he needed a urine sample and a stool sample, so I just gave him my underwear. So that'll work. And when you say changing the shape of the curvature of the spine, my mom turns 80 this summer, and she's laughing all the time because she was 5'2". Now she's under 5 foot.
Yeah.
She can't believe, she's embarrassed to say that she's 4 foot 11 and a half or 3 quarters. She's telling me, but so that's just the exaggeration of the spine curve?
So that's a little bit different. When people start to lose that height, it's typically in the disc space. So we have that kind of cushion in between our vertebrae, and just over wear and tear of time, that space and our vertebrae just aren't as supportive. So it loses some of that height.
And I read a deal one time that when you come back from the space station after you've been up there 100 days in zero gravity, you come back taller. Because standing on the earth compressing down, you had no compression, so you relaxed and rehydrated all your disc and all that. But sorry to keep interrupting. So
no, that's okay.
So you were going to use your model to explain pelvic floor dysfunction.
Yes. So this is a female pelvis, but I always get asked, well, what about men? Yes, men also have a pelvic floor. So the pelvic floor, which is all of these muscles here in the red that you can see, the pelvic floor muscles do a few things. So they help to support bowel and bladder. They help with sexual function. They help to stabilize the pelvis. It also helps to like a sub pump, like when we take our breath in and we've got that nice kind of downward pistoning action of our diaphragm and pelvic floor that helps to keep circulation in and out of pelvic floor.
Accordion.
Yep, absolutely.
The diaphragm and the pelvic floor.
Yes, yep. As we take our breath in and our diaphragm descends, there is a little bit of pressure down in pelvic floor, and then when we exhale and relax, it kind of comes up together. So they work together like that, and that helps to kind of keep things moving in there. And it also helps to transmit forces from our upper body to our lower body. So sometimes if people are having hip issues, knee issues, and it's something that, okay, they've been treated for their knee for a while, but it's still coming back. Well, let's look through the pelvic floor, because everything we do, has to go through that center piece. And this is right at the center.
So you can tell by looking at a skeleton if it's a boy or a girl? By looking at the pelvic area?
Mm-hmm. Yeah, so a male's pelvis is a little bit smaller. And then the shape here is not as, the angle is different. So, and plus the anatomy.
And when senior citizens fall and break their hip, what area usually breaks?
There's a few different areas that I see a lot. So sometimes they can break this pubic ramus portion here. This here is the acetabulum, where the head of our femur sits. So sometimes they can have a injury to this portion here, or to the actual femur itself. So it can be, and on the femur, it can be the head of the femur, sometimes the neck, that little skinny part, or the shaft.
And breaking a hip, I don't think people realize how serious that is. I mean, the mortality rate after grandma or grandpa breaks her hip, the percentage of people that are dead within 3 years, do you know what it is?
No, it's huge.
It's huge.
Yeah.
And so here's your homework assignment. If you're a young, spring, 55-year-old chicken like me, and you have an 80-year-old mother like I do, I mean, when you read on that, it's still the craziest things in the world. Women put these little throw rugs in their kitchen, around their toilet. You don't decorate your toilet. You don't have throw rugs. You need to go there, and if mom's got these cute little knickknacks that she bought at a flea market to decorate her bathroom, you need to get that stuff off of there, because, my God, she slips and falls. It's like 1 in 3 are dead within 3 years. You can have that hip surgery and get a staph infection. I had a patient have just a routine hip surgery, and he fell down and cracked it. He was in the hospital on IV antibiotics for a year. They couldn't control the staph.
Yeah, it's scary. A lot of times, too, what can happen is they were somewhat mobile before, maybe shuffling along, maybe had a little bit of balance issue, and they fall, and then they're scared to get up again. And so they become more sedentary, and they sit in that chair, that recliner, and they don't move. And so then they develop pneumonia or pressure sores. And so then their body just is not as mobile and functional as before.
Pressure sores from their bed?
Yeah, or wheelchair.
You know how to make a water bed more springy? You fill it with spring water.
Oh my gosh.
But so you see more women than men, but you said it's not all because of childbirth.
No.
But what if someone came into you because it was caused by childbirth? What happened? It came apart, then didn't go back together all the way, right?
There's a few different things I see after childbirth. Sometimes what can happen is urinary incontinence. That is typically because the pelvic floor has become weak or overstretched. The pelvic floor muscles are just like any other muscles in our body. They can get tight, they can cause trigger points, they can get weak. And so urinary incontinence is just a symptom that something else is going wrong. And so...
and that's my beef with the U.S. healthcare system, because they really believe in pharmacy. And it goes all the way back to the medicine man. Every time you got sick, and I went to a medicine man when I was in Brazil. I had the honor to lecture to dentists in 50 countries, and they said, "What do you want to see?" And they were telling me this stuff. I said, "I want to see a witch doctor." And he said, "Really?" We were in Sao Paulo, Brazil. He goes, "I know where there one is. It's out where my mom lives." We drove an hour out down dirt roads, and they had the paint on, and they had the lotions and potions and dancing, and that turned into pharmacy. I mean, when Americans have urinary incontinence, they want to take a pill. And by the time they're on 5 different prescription medications, the compounding side effects, it's called polyphagia, and it's horrible on their life expectancy. So if someone has urinary incontinence, their first knee-jerk reaction is, I got to take a pill. And you're saying there might be physical reasons to quit it.
Absolutely. So urinary incontinence is one of the things I see postpartum. Another one that I commonly see is pubic symphysis dysfunction. So the pubic symphysis is that kind of where the bones join in the middle. And again, after childbirth or carrying that child, our posture changes, our joints and ligaments get a little bit more slack, and so that can be a source of discomfort and pain. A lot of times when women do have that, they're having issues with walking, with going up and down stairs, getting in and out of a car, and it's right there, kind of right in the front of that pubic
Would that
bone.
also be irritated during sex, since it's right there on the top? Is that pain during intercourse?
Not necessarily.
Not necessarily.
It could be, but more position dependent. Sometimes, so painful sex or dyspareunia.
What's dyspareunia?
Painful sex.
Painful sex.
Yeah.
Dyspareunia.
So what can happen sometimes with dyspareunia, if women have an episiotomy or a tear, and there's stitches used, that tissue can sometimes adhere down or scar down, and so though it's not as mobile, and so that can be very uncomfortable with intercourse. And or sometimes those muscles can just get really, really tight. Some people hold tension in their necks, some people hold tension in their pelvic floor. So that too could be a cause
I want to go back to urinary incontinence, and I'm just asking for a friend. I got you covered, Ryan. And but what is normal and abnormal? Because I mean, I remember back in college, really healthy young guys laughed so hard they peed a little in their pants. What is there a normal amount of accidentally you're laughing, giggling, you fall down, you lifted too much weight? Or is just any form of it, really?
If you're not wanting to go and you leak, that's incontinence. So even
but just leaking, but not like when you were laughing really hard or
that's a form of stress urinary incontinence. So there's
really?
Yes. So there's three big main types of urinary incontinence. There's urge.
Urge?
Yep. Mm-hmm. So that is when you get this really strong urge that you need to go and you're not able to make it to the bathroom.
Okay.
And then stress urinary incontinence is when you leak, when you laugh, cough, sneeze. And then there's a mix, which is a combination of the two. Sometimes there's like an overactive bladder, which is a frequency issue. So that's when people may have to, are going every 15, 20 minutes. And it's been, very disruptive on their life, their work,
yeah,
travel.
I imagine that'd be horrible having to go every 15, 20 minutes.
Yes.
But there is new technology that we didn't have when we were little. I mean, I just read, if you take the 20 richest countries in the world and back it on immigration, their populations are shrinking. Mm-hmm. And since all these countries have healthy, robust immigration, they're growing, with the exception of Japan, because they're a closed society and they don't want any immigration. So 6 years ago, Japan started selling more diapers to elderly than they're young, because you need 2.3 children to maintain the size of the herd. They're down to 0.9.
Oh, wow.
And if you go into America, 27% of baby boomers had no children. But since we get 1 million immigrants a year and all throughout Europe, they're growing. But so if you're going every 15, 20 minutes, I would just be wearing Depends.
Yeah. It can be really devastating. And I think too why a lot of people don't hear about it is there's a stigma of shame that comes along with incontinence, whether, especially with urinary incontinence. That it's really easy to cover up. I'm just going to wear a pad or a Depends, or I'm not going to drink as much water, and you can't see it. It's not like, I've got a sling on my shoulder, or I can only reach up this high, or I've got a a funky walk, or a walker. So it's
Now, that's
really
a word
easy.
I haven't heard in a while. Funky.
Funky.
I have not heard that. What was that song? Play that funky white boy. Play that funky music, white boy. That's
you
a
go.
blast from the past. That came out of your ASU sorority days.
There you go. And so it's just easy for it to cover up, and you don't sit around the dinner table saying, hey, I peed my pants today. It's just not something that's talked about, and I really want to change that. I really want it for people to make it okay, especially to talk with their doctor. Only 40% of people discuss this especially elderly, discuss this with their doctor. 40%. And so, but there are simple things that can be done and modified. What got me into this pelvic floor focus was I was working in the geriatric population, and I love the geriatric population. And one of the screening questions I would always ask was, how are you sleeping at night? Because I thought, how can I rehab you after your stroke or your open heart surgery or your hip fracture and ask you to be doing these exercises if you're not sleeping well? And so I'd always ask about sleeping. And 9 times out of 10, people would say, oh, the usual, I get up every hour or 2 hours to go to the bathroom. And I thought, no wonder your body's breaking down and you're tired and you don't feel well, because you're not getting the rest that you need. So that's what took me down this path, and I haven't looked back ever since. There's a huge need, and that's what I'm here for.
I want to say something about, you say only 40% bring it up to their healthcare provider.
Mm-hmm.
I've noticed for 30 years that sometimes when you're asking personal questions to grandpa, and there's a young female dental assistant there, and he just climbs up. Mm-hmm. And I've learned over the years that sometimes if you just sense that, I always say, would you mind leaving us alone and closing the door? Mm-hmm. Sometimes they open up more, and
Mm-hmm.
but I bet you grandma to a man is even off the charts.
Yeah.
So what is an exam like with you? Your website is Kim Bryant PT. What are my homies going to find at Kim Bryant PT? And I want to back up. Before you say, I want to say something, because I've been asked this question for 30 years in Ahwatukee. Mm-hmm. Well, what's the difference between a physical therapist, a chiropractor, and a massage therapist? Are those all the same things? I think there's some market confusion. You got a doctorate in physical therapy, so you know exactly. But I think there's a lot of people who see that as a big...
Yeah, well, I think that those 3 different types of therapies work well together. So a physical therapist really specializes in the movement patterns, the musculoskeletal system, identifying some of those impairments where things are not moving well, and then reintegrating the normal function, how our body is supposed to move, whether that's after an injury or a fall or just immobility. So that's...
people know when you go to a dentist, you sit in a dental chair. They think when you go to a psychiatrist, you lay down on the couch, but I'm pretty sure that's Holly weird. But when people go to you an appointment, are you working out with them in a room? Are they laying on a table? Do you do stretches? What is an appointment like with you?
Yeah, so the initial evaluation is just very similar to one that you would see if you were going to a physical therapist for anything else. I took a thorough history. There's consent forms. But what's a little bit different with a pelvic floor is I'm asking a little bit more detailed questions about your nutrition, your liquid intake, your diet, your exercise, your bowel and bladder habits, your childbirth history, any sort of particular falls on the pelvic floor. A lot of times people have had falls from skateboards or roller skates or skis, and so that all too can contribute to.
Do you get a lot of auto?
Not as much.
Not as
no.
much. It's very concerning about the autos because when you looked at the deaths for, like, if you read the CDC's weekly mortality report, there were 30,000s. 30,000 died each year in a car, 30,000 died in an accident, and 30,000 killed themselves. But the drunk driving when we were little was a third of all those causes, and they almost cured that, and the country didn't really celebrate it. But it's gone from 30,000 to 40,000 because of this. Mm-hmm. And when I do my morning walk, I walk to Safeway and back every morning. It's 3 miles each way. Mm-hmm. And if you leave in the dark, every third car, you see this right by the deal, and you're like, you can't walk in the street. And we've had 2 people in Ahwatukee in the last 6 months that were killed walking on the sidewalk. Mm-hmm. So distracted drivers. And then that 30,000 accidents, that bothers me because that's more men than women. It's the man falling off the roof, falling out of the tree. Mm-hmm. But you're not seeing auto accidents, but for weekend warriors, falling, skateboarding, all that stuff, is that more men than women?
I don't know that statistic. I'm not sure.
You want to hear a creepy stat from dentistry?
Sure.
If you find a skeleton and one of the front 2 teeth was treated with a root canal buildup and crown, mm-hmm. it's a 95% chance it was a male. And for 30 years, I knew that from school. Every time some boy came in, I said, "What were you doing that your sister wouldn't have done?" And he would, his sister would ride the skateboard. He was going off a ramp. His sister would ride her bike. He was going. He was always. And then I'd explain to him, you only break off your front tooth when you're doing something your sister wouldn't do. And when you look at those 30,000 accidents, it's the majority of men. And then suicide is the majority of men too, because when women attempt suicide, it's always non-violent. It's always a cut or a pill or an overdose. But men are always violent and do it with a weapon. So the men's attempted to completed suicide is damn near 1-to-1. Mm-hmm. But women, their attempt to completion is very, very low. So it's urinary incontinence. And back to that bowel and bladder.
Yeah.
The weird thing about that is those are things you don't talk about.
Yeah.
So should you just have one bowel movement every morning? Is that the majority, or does a half the population have one in the morning and one at night, or... Explain to someone who's never talked to anyone about their bowel and bladder habits.
Yep.
Like, how many times should you get up during the night?
So if you're under the age of 65, it should be 0. If you are over the age of 65, what's considered normal is 0 to 1. If it's any more than that, then there's a problem. Unless you're taking something like a water pill or LASIK, sometimes those can impact the frequency.
A water pill or a LASIK?
A LASIK. So sometimes if you're like congestive heart failure and you're or edema or localized.
So swelling. I'm 55, so I should not be getting up in the middle of the night?
No.
Wow.
Yeah. So normal bowels is anywhere from 3 times a day to 3 times a week. That's what's considered normal.
Bowels, meaning bowel movement?
Yep. Mm-hmm.
So a bowel movement 3 times a day?
Yep, could be normal for some.
3 a week?
Mm-hmm. Yep.
So how can you get to that 3 a week status?
Well...
It seems like you'd save a lot of money on toilet paper if you go from 3 a day to 3 a week.
And save water, I guess.
So what percent of America do you think under 65 gets up at least once in the middle of the night and goes to the bathroom?
Oh, if I had to take a wild guess, I'd probably say more than what should. Probably 50.
So you think that's something they're doing wrong in their exercise, diet, lifestyle?
It could be a variety of things. Typically when I'm treating people and they're having issues with overnight episodes of urination or nocturia.
Nocturia? Mm-hmm. That's urinating at night?
Yep.
Nocturnal? Mm-hmm. Okay, yep. Nocturia.
Usually I'd say let's fix the problem during the day. There's something going on during the day that is contributing to that habit at night. So a lot of times I'll get people that are having urinary incontinence. Which is involuntary urinating. Mm-hmm. Yep. So they stop drinking water because they don't want to go. And then that irritates the bladder, the lining of the bladder, because it gets more concentrated. So then they're going more. Then they're also afraid to have a leak before they go to out to the mall or out to the restaurant, so they're going just in case, which I call JIC, just in case voids. And so their bladder actually starts to shrink. And so now it's not able to hold what it should because of the habits and behaviors they're doing during the day. It's going to contribute to...
If a weightlifter goes and starts lifting weights, his muscles get bigger. So during the day, when you felt the urge, you said, no, you hold it. I'm just going to go, breakfast, lunch, dinner? Would that be reasonable?
It's the window is every 2 to 4 hours.
So you get to work at 8. And you just said, I'm not going to go to the bathroom every 2 hours. I'm going to hold it till lunch. And would it be like lifting weights where at first it'd be like, wow, I'm really, really holding it? And then if you kept that pattern where when I sit down at 8, I'm not going till noon, would it eventually the muscles build up and then you wouldn't have that simple urge?
Possibly, yes. Yep.
Possibly, yes.
Yes, yeah. It's not always that clear cut. Sometimes it also can be impacted by your stress level. And the types of foods in your diet. So there are bladder irritants. So things like tomatoes, caffeine, coffee, chocolate.
Oh, we gotta stop right there. Caffeine is the #1 abused drug on earth. People always talk about, all these other drugs, but I mean, God, there's a Starbucks on every corner. When you go to work, they're either carrying in a Starbucks or they're brewing a pot of coffee. And then what's also interesting is when you go to dinner at people at night, even my mom, I don't know if I can say this for HIPAA, but all of her little old lady girl, they're all ordering coffees after their dinner at a restaurant, and it's dark out and it's late, and some of them are having espressos. And then you got other people who are go late at dinner and they're drinking alcohol. So what does late night alcohol, late night coffee after dinner do to your sleeping all night without getting up and going to the bathroom?
Well, I think both of those can contribute to not sleeping well. But as far as the bladder, those can be irritating to the lining of the bladder and make you need to go more. So that too could be impacting your overnight voids or getting up at night.
So you're saying you should pour the vodka in your coffee, that if you combine them, they'll neutralize each other.
There you go.
And then there'll be... Is that what I think I heard her say that? So I'm sorry, I've interrupted you so many damn times because you're so damn interesting. But what are they going to find at Kim Bryant PT? What if they have a question? I see this. Send me a message for a free email consult. They can also email you directly, Kim B. at Kim Bryant PT. Is that okay to give over the name?
Oh, absolutely.
And you're in Lakewood, working out of your house. So you come into your house off of Chandler. If Lakewood basically has 4 inches. There's Chandler where they have the fountain.
Yes.
Which some nice young man dumps a box of soap in about 1 time a year since I've been here. Do they still do that, or do they?
Every once in a while.
Yeah, get over that, millennials. Okay, it was funny. It was funny the first 25 times, but after 30 years, be unique, okay? Think of something different. So which Lakewood entrance do you go in? Because there's 4 in and out. There's one by Desert Vista.
Chandler, coming off of Chandler and 40th Street, right by where the fountain is.
Yeah. So you work out of your house. So what's that like? You have 2 boys, 4 and 6. Is that neat? You get to work from your home and be...
They go to school.
At 4 and 6? Oh, 6 is first grade?
Is kindergarten.
See, mine are so old.
Yeah, so he started kindergarten, and then the other one goes to preschool, goes to Bienvenidos. They're at Lagos.
Wow, I feel old. My grandson is 10, 6, and 1. And so if you're wondering, Ryan, why does she look so good and not me? Her oldest child is in 1st grade. I got grandkids, so what's it like working out of your home?
I love it. I really feel like that when people come in, that I can teach them how to do these exercises in their home. I had a mom come in the other day, and she brought her newborn, and it was comfortable. She didn't feel like you don't need to get ready. You don't need to have all these items with you. It was just, when her child needed to be changed, it was okay, and I like to use the things within their home so that we can simulate how they move. How are you going to get this carrier in and out? How are you going...
Carrier.
A baby carrier.
A baby carrier.
Yeah.
The car seat.
Mm-hmm. Yep, those sort of things. Let's look at how
are you old enough to remember Jack LaLanne?
The name sounds familiar.
Yeah. God dang, I just need to hurry up and die. I'm so dead. But what Jack LaLanne started the whole workout, aerobic, all that. And the thing I loved about Jack LaLanne is when we were little, I had 7 brothers and 7 children, a stay-home mom, a dad who delivered rainbow bread, poorer than dirt poor. But Jack LaLanne knew America was like that in the 60s and 70s. And the only thing you needed for Jack LaLanne was to be in front of your TV and to have a chair. And I love that because now so much of the market is convincing you that to exercise, you need to have a Stairmaster and a treadmill and a rower or join Lifetime Fitness or join all these things. Yet some of the most rocking hot bodies you've ever seen are people who served 10 years in prison and were in a prison cell and even the Marine Corps, they don't use machines. They do pull-ups, sit-ups, jumping jacks, planks, and air squats. There's no machines. So, and those guys are trained to kill. So you're saying you can get physical therapy rehab with what equipment at home?
The stuff that I use is a TheraBand, like that stretchy resistance. I either use that or like a tubing. I use a lot of just our body. I mean, I am not, most of my patients are not there to be bodybuilders. I just need to reteach them how to use their body the right way. So I use their body weight and modify and change their exercises so that it's directed towards their area that they're having an issue with.
What's the difference between laying on your back on a bench press, benching 100 pounds, by just flipping over on the floor and doing a push-up? You know what I mean? I remember it was so funny because some friend of mine, child wanted a Stairmaster. So he went out in the garage and brought in a $1 concrete block, set on the floor and goes, there you go. Just step up on it and step back down. There's a $1 Stairmaster. You don't need the $5,000 one. Do you recommend that they send you a contact about what their problem is, or do you like to talk to them over the phone? What is your initial consultation like, and what does it cost? And does it take insurance?
So if someone... I prefer to talk with someone because I can ask the right questions over the phone. So I
You want to give out your number on this?
Yeah, absolutely. So
what's your phone number?
It is 602-791-9298.
602-791-9298. Oh, that's pretty easy. It's 6027, then it's 91, 92, 98. 91, 92, 98. That's an easy one to remember. And then Kim B at KimBryantPT.com. So these people call you and do what percent of your patients, I mean, is this covered by their health insurance, Medicaid, Medicare? Is it cash practice?
The only insurance that I'm accepting right now is Medicare. I'm contracted with Medicare. And so that covers that first 80%. And then it's automatically sent to their secondary if they have one. And it depends on if I'm an out-of-network provider for them and what their out-of-network benefits are. So if that other 20% is not covered by their insurance, it typically is about $20 a visit.
Okay, explain to the kids. There's a lot of kids from Desert Vista and Mountain Point. A lot of high schoolers. They're more likely to be on Snapchat, Instagram, and Tukeetown than grandpas like me that have grandkids. They always hear in Medicare, Medicaid. What's the difference between Medicare and Medicaid?
The Medicare is when you have to qualify for that.
Well, it's a federal program.
I believe they're both federal programs. Both
Medicaid is state
and Medicare.
Medicare is federal.
But
Medicare is federal for all your grandmas and grandpas automatically get it when they start receiving Social Security. But Medicaid is state by state, so Medicaid in Arizona could be completely different than Medicaid in New Mexico or Colorado or Utah or California.
Oh.
So you just say the Medicare, the national program, which was really confusing to so many people when Obama did the Affordable Health Care Act, because you already had this national program that everybody loved. When people say they don't like Medicare, it's like I've never met one senior citizen in my practice in 30 years that would give up their Medicare. But the state, so he did Obamacare through Medicaid. So the Affordable Health Care Act, known as Obamacare, it was called something different in every state. Like people who had access in Arizona didn't know that was Obamacare, and it was just a cluster. And nobody can figure out, well, why didn't you just expand Medicare?
Yeah.
I mean, Medicare already covers everyone 65. Why didn't you cover it for everyone under 65? Why would you do 50 different state programs? But it was very popular. I mean, 10 million people joined. But you're only doing Medicare.
Yep.
You're not doing Medicaid.
No, not Medicaid. Yep, no access or Medicaid.
And so those are usually the seniors then. So what percent of your practice is on Medicare? Because they would have to be over 65.
Right now, I would say about 50%.
Half are over 65. See, I wouldn't have guessed that.
Yeah.
So half your clientele is over 65. You could almost say you're in geriatric physical therapist.
Possibly, yes.
Yeah. So those are more fall down hip. Why is it half? Why is half over 65?
I think because that's when they're starting to have issues with incontinence, and a lot of them don't want to have surgery.
So of your over 65, what percent is incontinence?
Well, that's primarily what I'm treating. So with the clients that I see, I would say 90% of those that are 65 and older, I'm treating them for some sort of incontinence.
And they're trying to get physical therapy as opposed to pharmacologically taking a prescription or surgery? And what is the medication? And when you do physical therapists, do you recommend they stay on their medication for incontinence, or can you usually get them off of that? Or what is the go-to incontinence medication? Which is more proof that I don't have it.
What I see is oxybutynin, which helps with overactive bladder. I see that one. And what's the other one that I'll see? I'll have to get back to you on the other one. That's the
okay.
big one.
And then what's the surgery?
They'll do like a bladder repair if they're having issues. Sometimes the issues with the incontinence could also be from prolapse, and that's a whole nother topic. But so if they're having issues with incontinence because of prolapse,
then you do have to have surgery.
It depends.
It depends.
Yeah, it depends on how severe the prolapse is.
Well, you know, we're so lucky here. We have a Mayo Clinic here, and there's only it started in Rochester, and they only had 2 satellites, one in Scottsdale and one in Florida. They did a big study on high blood pressure. Still say to it. In fact, they wrote a whole book on it called The Cave Factor. 92% of people can get off their high blood pressure medication with diet and exercise, and eating 4 grams of potassium for every gram of sodium. They eat all this processed food. I mean, you're supposed to only have a gram a day. A can of soup has a gram. A hot dog has a gram. And the only place you'll find potassium is fruits and vegetables, which they only eat fruits and vegetables if it's in a packaged box and turned into a potato chip. And I've always noticed that in 30 years of being down in Ahwatukee, the seniors who, when they got high blood pressure, first tried to fix it with change of diet and exercise versus, just give me a pill. The craziest one is erectile dysfunction. I mean, the number one goal of a species is to reproduce and have offspring. When you can't do that anymore, usually you have coronary heart disease, diabetes, you have all these diseases, and they go to the doctor and they give them a pill. It's like, dude, when you can't reproduce anymore, your mortality rate is off the charts. And I really think that the millennials are going to be different than the baby boomers. I think the millennials are watching their parents taking all these pills. Even the younger dentists are, and you see the younger dentists, and they're talking more holistic, alternative, integrative medicine. They're all systemically. You go to a 65-year-old dentist. I didn't say 55, I said 65. And, you know, like every root canal, just here's antibiotics, here's opioids. I mean, it's like, wow. But the next generation, of millennials. They got a Google search. I mean, when I was little, you know what my Google search was? Born in 62. When I turned 10 in 72, my mom at a garage sale found a set of encyclopedias that was printed in 1952. She still has them. So my first Google was 20-year-old books. And we thought we were in hog heaven.
Yeah.
To 20-year-old outdated information. These millennials are sitting there every time you tell them they have this disease, they have this, they go straight to Google. But I just got to say one thing. I'm only an expert in one thing, and that's dentistry. And you take something like water fluoridation. 95% of all the sites are junk, crazy, laughable. Make sure when you're studying issues that you go, for instance, when I was little, we went to Catholic school. When we had to do a homework assignment, what did we have to do? We had to go to the drawers. First, we had to do the author search. Because if you went and got a book on Mars and showed Sister Mary Aloysius, she'd say, who's that person there? Well, what if he's crazy? What if he just got out of jail? What if he murdered 8 people? You're gonna start swallowing hook, line, and sinker, drink the purple Kool-Aid on this guy who wrote a book on Mars. You don't even know who the hell it is. First, it was an author search. Then you got your author approved. And then once you said, okay, well, this guy works at NASA, the Jet Propulsion Laboratory. He has a degree in astronomy or, whatever. And yeah, he's a good author.
Yeah.
I would take information in from this author. And then you go find a book. Today, they'll just search water fluoridation, and I mean, 90% of the site. And by the way, money's the answer. What's the question? At the end of the day, they're all trying to sell you reverse osmosis. There's money to be made.
Yeah.
The one thing I found, even that most famous, who's that most famous conspiracy theorist guy podcast? Alex Jones. 2020 did a big segment on it. The whole deal is because those people who follow him and believe all those conspiracies believe all these claims from all these products he sells. And he's collecting you as an authority, then he's selling you all these things that probably don't do anything it says. So what is a credible website to get information on physical therapy? Would it be Mayo Clinic? Would it be, what would be credible websites?
I would go to the APTA, which is the...
Can you send me that? I'm guessing the American Physical Therapy Association.
Man, you are right on.
My gosh, I just look stupid, but I'm actually not. Okay, and so that's a credible website?
Yes. Yeah. I would start there. If you have questions on coverage or other type questions, you can always go to Medicare.gov. For Medicare type questions, I get that a lot. What's my coverage? What's the difference between Medicare A and Medicare B? And then if you have other questions as far as pelvic health goes, you can go to Herman and Wallace.com, and that's one of the big Herman pelvic floor group. And there's also the APTA section on women's health is also a great source to go to.
Yeah, and you're lucky that you didn't have to go to Catholic school and be taught by Sister Mary Aloysia, but I'm telling you, you'd be better off for it. And I went to Catholic college too. I went to Creighton University with Jesuits, and the Jesuits, I don't know if you know this, it takes 17 years to be a Jesuit. I mean, they're just brutal when it comes to your source. And I, when the internet came out, I was so young, dumb, and naive. I didn't get internet religion until '98. When it first started out, you were getting it for your kids to do homework, and they all went to, where'd you guys go? Estrella, Akimal,
and DV.
And DV. Estrella was the first one.
Yep.
I think it was your 6th grade teacher for Eric. He was born in '89, so '98 he'd have been 9, so he'd have been in Mr. Burkhart's class?
Mr. Burkhart was the wrestling coach, and he taught science at Akimel, and then Mr. Caldwell was the
Mr. Caldwell.
teacher.
Man, I want to get him on this show so bad.
He just retired last
Yeah, but he
year.
retired because he's very upset with the Kyrene School
that's-
District, and we need to get him on the show and talk about that. So we got it for the kids' homework. And most all my friends, all my dentists my age in Ahwatukee that had kids, we were all getting it for our kids. And it was an AOL dial-up and all this,
Yes.
and we thought, and I can start remember saying, this is never going to go anywhere.
Yeah.
But when I started got it, I thought, my God, this is going to give everybody. I mean, I kept thinking about my little Encyclopedia Britannicas, and then Wikipedia is 50 million pages, all updated today. And I thought, this is really going to educate the world. And it was the opposite. The internet is all misinformation. I mean, so like when I talk to a patient who's a pilot, I go, oh my God, if you Google airline safety or whatever, you know, everybody that knows their one thing, a dentist knows teeth, a pilot knows planes, you know, everybody I talk to is an expert in one thing. They say their one thing is embarrassing on the internet. 90% of all the sites is crazy, misinformation. You know, Larry's blogging about, you know, all this bull crap. And so, you know, you got to go back to that Catholic school and do your author search before you do your book search. Don't just start going to Google. And by the way, you know, Google doesn't send you to the best site. Google and Facebook, I don't think they're good guys. Google sends you to money's the answer is the question. So when you search urinary incontinence, Google's making money. They're going to send you to all the people advertising. So they have something to sell. I'm not saying that's bad, but it usually is. Facebook, 2/3 of all the news sites are fake news. And they know they were taking ads from Russia, but money's the answer. What's the question? I mean, these are not ethical countries. In fact, I like listening to Professor Scott Galloway of NYU School of Third, Stern, and I mean, he thinks they're horribly unethical, immoral companies. So again, you got to do your own search. Don't just Google urinary incontinence and go to the first 5 listed, which are all ads. Go to the American Physical Therapy Association, who is in where are they at?
I think Alexandria,
Virginia. So that's a suburb of Washington, D.C. So that's a suburb, and they got okay. I don't know if I want to follow them on Twitter. All my friends are going to think. Why is Howard following APTA tweets? The American Physical Therapy. Man, they got 53,000 followers. So see that. I mean, look at that. The American Physical Therapy nonprofit, 53,000 followers and one. And I know.
one.
And so they go to your site, KimBryantPT.com. They can contact you with an email asking a question. Your phone number is there. God, I can't believe we went over an hour. We're 3 minutes into overtime. Final question.
Yeah.
We talk on the phone, and then I'm going to come to your house and fill out paperwork, Medicare if I'm over 65.
Yep.
If I'm under 65, do you take my health insurance, or you said Medicare is the only thing you take?
Yep. So for others, it's just cash or cash pay. I have taken. I do accept like the Flex Savings account cards.
Yep.
So I can take those as well.
What about bartering? Like, what if I gave you Ryan and he could be your home slave?
trade?
Yeah, it's not.
Not at this time.
No bartering. You don't take goats, chickens, pigs.
But I do give you a super bill or a claim that you can submit to your insurance for reimbursement, or I tell people that they can claim it on their taxes.
And by the way, I want to say something about insurance, which is crazy. So many people come in and they say, well, why didn't my insurance cover that? Well, first of all, your employer bought it, and they're usually trying to buy the cheapest damn stuff they can buy. And I don't like, I think the biggest mistake in healthcare is that not even 10% of healthcare is insurance. Insurance is like auto insurance. Everybody has auto insurance, but only 1% of society stacks their car every year and makes a claim. So everybody pays a little for that one guy. Fire insurance on your house. I've lived in Ahwatukee 30 years. I've only seen 3 houses burn down. And all 3 were physical therapists drinking in bed, smoking, and they flicked their ashes in their tequila and it started a fire. So 3 for 3. And so you spread the risk around, an actuarial risk analysis versus moral hazard. Now let's go to health insurance. Insurance would be, I fell down and broke my leg. My kid got cancer. I had a heart attack. You know, I was in a car wreck. That's insurance. But when people just go in there and say, you know, I got a sniffle, I think I'm gonna sick, I'm gonna go to the emergency. Well, you just went to Mikaios for $50. You just bought an iPhone for $800. You bought a $30,000 car. You live in a $100,000 house. The first thing they should do with health insurance to control that cost is just make it insurance. Something where everybody pays a little in their taxes and you cover the big things. But when for instance, the free clinics in Arizona, the Medicaid free dental clinics for the poor, you go work at those, you know what the number one problem is? 50% no-show cancellation. See, they have no money in the game, they have no skin, they make an appointment for an hour with a dentist and a hygienist, they don't show up, who do I care? That's not about right or wrong, that's not how you manage people. And you say, well, they're poor. Yeah, they're poor, and they just bought a pack of cigarettes for $10. They just ate at Mikaios for lunch. When we were little, we took a school lunch. And if it costs them $10 cash to make that appointment, do you think they'd have a 50% no-show rate? And then if they canceled, the next appointment cost them $20 to make? Do you think they'd cancel the appointment? So, you know, if this is a manageable chronic thing, that's why insurance, and like Medicare, one of the reasons the cost is out of control is because like a knee replacement for 2 knees is $50,000. So the doctor says to grandma, you know, you really need to have your knees redone. No out of pocket for her. Says, okay, well, you're the doctor. Well, if there was a 5% copayment, so you take $50,000, I should be able to do this in my head, times 0.05 is $2,500. And you said, okay, well, you have a 5% copayment. You know what percent drop we'd have in knee transplants and all these things? When grandma said $2,500, how much is an average appointment for you if she was cash?
100.
She could have 25 appointments with you, or go buy Bufferin, Excedrin, and Motrin. But when you tell people that the poor and the elderly should have a 5% copayment, they look at you like you're some kind of sick, crazy man, like you're a Nazi or something. It's like, are you kidding me? That's how you manage people. And anyway, I'm off. You're never supposed to talk about politics, sex, violence. What was the other one? Politics, sex, religion. My two older sisters are Catholic nuns. You think there's any way I could have an hour-long discussion and they become Lutherans?
You know.
Yeah. So you don't talk about. I've never seen anyone after the age of 30 change their political leanings or their religious leanings.
Yeah.
And unfortunately, their healthcare leanings. And what I mean by that is, you either believe in the medicine man, that every time something's wrong, you go into the witch doctor, and he's going to make you a lotion and potion from Merck, Pfizer, Johnson & Johnson, Eli Whitney, and you're going to pick it up at Walgreens and CVS, or you go to your surgeon, and he's going to take out his knife and cut something off. And that's what 80% of the baby boomers and all the people on Medicare over 65 believe today. And the millennials, I think, are going to flip that. They're going to say, I'm going to believe in the health belief model, that the man in the mirror, my favorite song by Michael Jackson is Man in the Mirror. Because the reason you need so much government regulation is because so many people don't take care of the man in the mirror. If everybody just solved their own problems and worked on the man in the mirror, you wouldn't even need a government. You know what I mean? And when your cholesterol's high, you want to take a statin? And you know, some of the statin research showing that after, it's only a benefit for like 4 or 5 years. And that's plummeting. When you get high blood pressure, do you want to take a pill or quit eating hot dogs and canned soup? And when you have problems, do you want to exercise and go to a physical therapist? Or do you just want to get something cut off? So I really think the millennials are going to be our finest generation.
I hope so.
Yeah, I do too. And, well, of course, I don't care. I'll be dead in a few years, and they can do whatever they want to do. But, Kim, seriously, it's Sunday. It's your day off, you have a family, you have kids, and you decide to come to my home in Ahwatukee and talk to my homies for an hour and a half. You're just amazing. You did not call me, I called you. You're highly referred. Thank you so much
thanks.
for coming on the show today and explaining to everybody.
Yeah, thanks so much for having me.